Hi, hello everyone. Welcome to eyecareoptom. Today I'm going to discuss about how to perform direct ophthalmoscope. This direct ophthalmoscope used for examining the posterior part of our eye, parts like macula, optic disc and cup and posterior retina. And also sometimes it can be used in media opacities also. And the main important thing in this direct ophthalmoscope, we can use this in undilated pupils also. Coming to the parts of direct ophthalmoscope, we have a brow rest and we have a viewing window to see the patient's eye, and also we have a aperture control, and in down above the handle we have the illumination adjusting knob. By adjusting this illumination knob, we can control the brightness of this illumination, and by rotating the aperture control we can get this three different size of illumination: the bigger one which is used in dilated people, and the medium one in normal people or mid-sized people, and the smaller one which can be used in undilated people. And also in the head we have a lens wheel. It has a plus and minus power. Usually red color background power indicate the minus and the black color background indicate the plus power, and some of them will have a plus or minus sign on this. Before starting it, we can keep this at 0, keep your full brightness on and set your aperture size. Set the room illumination. It usually done in semi-dark room. It will be done in sitting position. Ask your patient to look straight. If you are checking for the patient's right eye, you should hold your instrument in right hand. Stand towards the right side of the patient and use your right eye to see the fundus. Same like this for the left eye, everything will be done in left side. You can start focusing around 20 cm from the patient eye, move closer until you reach out the red reflex. After reaching it, adjust your power dial to get the clarity view. Once you see the blood vessels clearly, follow them to reach out the optic disc. After reaching the optic disc, you can fix your location angle and you can move your DO slowly to check the surrounding areas. Move towards temporally to check on macula. And also you can follow the same thing for your left eye. About the other features we'll discuss in next video. Until then, tata bye bye everyone.